Yep.
Okay, lumbar traction, first thing you want to do is you want to drive your equipment to place. You want to check the machine for any abnormalities, make sure the cords aren't frozen. Your buttons there. Then you want to turn the machine on.
Make sure you talk loud with all the noise.
Oh, okay. And when that's turning on, you can place the equipment. You can verify your patient, make sure it's the patient you're supposed to be treating on. You want to verify for any contraindications, like any bone disease or osteoporosis. So you have him put this belt on. And you want to place it just above the iliac crest. Make it tight, but not too tight to where it's uncomfortable. Okay, and then you can go ahead and have them lay down in a comfortable position. You do want to make sure this circle's in the center of the body. You want to go ahead and strap this around your chest. You want to make sure that it's comfortable but not too tight, but it's also snug and secure. You have little armpit things you can put here if they feel comfortable or don't want to be pulled by a table. Tables are being locked, so you unlock the table. You can place these underneath their knees to help if they have any curve in the lumbar. Alright, so then you want to go ahead and go lumbar traction. Go to edit. For this purpose, since this is practical, we'll just leave that static, but we can change the steps. Just change it to 3 for beginning and end. If they had any muscle imbalance, you use intermittent. So you go to edit the max and min levels. So you'd ask the person's body weight if you don't mind sharing. Go ahead and enter 150, and then for the max level you enter 50%. Minimum level you enter 25%. And you go in and go back, calculates how much you're supposed to, or how much weight's going to be pulled. So you can go ahead and hit the rope release button. Attach it. Slack. And then for the angle, you want to go ahead and have a neutral with the cord. Speed you can do the same. You go ahead and do the patient companion button. And then you go ahead and you hit start. You explain to your patient that they're going to feel some tugging and they will be sliding a little bit. Throughout this, you just want to make sure all the straps and stuff stay secure, and that and monitor with the patient to make sure that everything's going okay. It's not too much of a pull. So you hit the panic button, you go to touch screen, and it'll shut it off. It'll start to go down with pounds. And then once it gets back down to 0, you can go ahead and hit rope release to unhook the cord. Put it back. And then you can start taking the equipment off. You replace the equipment back where it needs to go. So start them to sit up slowly. And then you'd ask the patient how the treated area feels, ask if they have any questions, and move forward.
You said you're going into cervical, correct?
Yeah, we'll just keep it.
Yep.
Okay. And then for cervical, you do all the same things. We're checking the machine for abnormalities, making sure you're verifying the patient, and grabbing your equipment. And for this, just want to go ahead and stick in there without working. So then for this, you instruct the patient to lay down in a comfortable position. And then you start tightening the mandible process. And you ask the patient, let you know when it feels good. Okay. So you go ahead and put the fourth head strap on. Want to be secure but not too snug. And then you can go ahead and release the rope. And for this, you want the angle to be at 20 to 30, so we're fine. And you go ahead and hit home. And for this one, you go in cervical traction, edit. Same exact thing with lumbar. You can change the intermittent if they have a soft tissue thing, but for the purpose of this, we just leave that static. So you can go to edit min-max levels, and you type in 25 for the max, and minimum would be 5 pounds. Go ahead and give your patient the panning button, and then you can edit the hold times as well, but for the purpose of this, we'll just leave them where they're at. And then you go ahead and start, and then again you did inform your patient that they're going to feel some tugging and some pulling up on their neck to relieve some of the pressure. And then you go ahead and make sure the treatment's zeroed out. Panic button. Unhook your patient. Put the equipment back where it needs to go. Ask them how the treated area feels, if they have any questions, and record your